I'm talking about my 3 favorite ways to mobilize C-section scars today. My name is Dr. Alyssa Cohen with Pelvic Floor For Moms. So I was gonna film separate videos on like different ways, but honestly, I don't think one is better than the other. I think whatever tool works best for you is what you should use. And so therefore I'm gonna talk about the 3 I recommend the most, and then pluses and minuses, and you can decide which one you like the best. So I have my really pretty C-section scar drawn on. So first thing that you can do is just mobilize with your hands. So whether you're like laying in bed at night, with a lot of this stuff, there's really no right way. So you can just do circles up and down, across the scar. That's like beginning stage, I should say. This is all for when you're past that 6-week mark, you've been to your provider, scar is really well healed, you have clearance to do whatever you want. Don't do this in the early stages. This is a little more aggressive mobilization. So across the scar, and then eventually we want to start picking that scar up. So we want to be able to pull those layers of tissue away from the tissue underneath it. So like just like belly skin up here, you can kind of pull that skin away from your layer of muscle. We want to try to achieve that down at your C-section scar as well. So that would be the goal. If you have an actual scar there, that tissue is going to like invaginate. It's going to like cave in on itself, and we want to try to avoid that. We want to try to get away from that. So that's one way. The other way that I like just with your hands is to bend over and really just get like a really good handful of skin in your hand and pulling, again, up, down, circles, it doesn't really matter, but I feel like using gravity to get the skin into your hand helps you just get some real estate on it. The reason I like this way is because you can do it anytime, anywhere. You didn't do it during your day, but you're like, think about it at bed at night, great, do it. It's very accessible, requires no tool, so really simple. Next tool I like is using a Pilates ball. This I think of being more like fascial mobilization, so it is gonna get those, layers of scar tissue, but it's also gonna help mobilize like organs and things like that deep in there too. So you're putting the Pilates ball over the C-section scar. If you have more pulling on one side than the other, put the ball over that side to start with, and then we're gonna lay on it. So laying on the ball, and I want you to just relax everything. So I usually put my head down on the floor. Sometimes I put this other knee up so that I can kind of balance on the ball. I'm gonna lift my head up so I can talk better. But then we're just doing some deep breathing. So you're doing some nice breathing, filling up into your back, but also aiming your breath down into that ball. You're thinking about cues like let the ball sink into your abdomen, let your tissue melt around that ball, letting everything relax and soften. This is a little bit longer process. So you're gonna spend like 3 to 5 minutes in that one spot. You should feel a really like global pull or stretch in the area of that ball. And if you have more time, move over, move 2 inches towards the middle, move 2 inches towards the left side. Do it wherever. The reason I like this method is because you're gonna mobilize lots of things. You're gonna mobilize skin and scar tissue and organs and some of those deeper things that also can get tight, and fascial restriction can happen there. I find that people tell me when they do this, I assign it for more than scar work, but it helps people connect to their core, and especially breathing into where that ball is helps people find those core muscles a little bit better, again, post C-section. So that's why it's nice too. Negatives, it does take some time, and also you have to have a tool with you, right? So if you are in bed at night, you can't do it. If you go on vacation, you're probably not gonna bring your Pilates ball necessarily. You can travel with a Pilates ball, it's really excellent. But not as accessible as having no tools. The third thing that I have people do is some cupping. So I like these silicone cups to use at home. You can see that you can squeeze it and then let it go. So to apply the cup, you're gonna squeeze the cup, stick it on your skin, and then let go. I don't have any lotion on right now, but it will suck your skin up into the cup, and then that's how you apply it. So ways that you can use the cups. First of all, you can go up and down across that scar. I'm obviously not having the cup applied right now, but up and down across the scar. That being said, you do want to use lotion or something. Use lotion or oil, something that's going to make your skin really slick and not sink in, so you can really get in there and the cup is going to suck up your skin really well. Use some lubrication. Up and down across that scar. You can go across the scar. You can go across above, across below. You can also just stick the cups on and like maybe put 2 or 3 across the length of that scar, and then just go on your way. Leave them on for 10 minutes, do your day-to-day activities. Really simple that way. You don't have to, you can incorporate it into your daily activities, so simple. The other thing I tell people to do is put your cups in your shower, so then it connects cupping to one of the activities that you're already doing. And similarly, you can get in your shower, stick it on there, do your whole shower while they're on there, and then you might spend the next 2 minutes, you know, mobilizing and whatever, but then you kind of guarantee that you get your cupping done for the day to some degree. So those are my 3 favorite ones. Take your pick. They're all good for different reasons.